This should be saying physical therapist showing you some really cool yoga maneuvers. Hi, I'm Dr. Eric Janowitz, chiropractor, and today we're going to be reacting to a real popular video on YouTube called How to Crack Your Own Back Without a Chiropractor, brought to you by two of my physical therapy friends here on the internet. So let's take a look at them.
Bob and Brad, the two most famous physical therapists on the internet.
Good jingle.
Hi, I'm Bob Shrum, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to show the folks out there how to crack their own back
You better believe it.
without a chiropractor or without a physical therapist.
It's funny they didn't add without a physical therapist on their title, by the way.
I use my office chair, my computer chair, quite a bit at work.
You really need a specific chair for this, Brad. I mean, the shoulder blades have to fit over the top of this.
Right, if it's too high, it's not going to work.
Right, and if this is not solid, you know, you can't have a flexible back on this, so.
And yep, and then you're going to go back like this and relax. And I usually go like this. And then
Just
I'll
leans over the back of
yep.
the chair, so the edge of the chair is using it to
It just
crack
went,
the back.
Bob. Oh, and then I slide.
So I've seen this happen a lot. I see a lot of people do this even at restaurants where they'll lean over a chair and try to crack their own back. The problem with this is specificity. Number one, is it a problem that needs to be corrected in extension, right? Or does the joint have to go in a different direction? And how on earth is the patient going to know, the person doing this, trying to relieve themselves, how are they knowing which is the exact vertebra? And sometimes vertebrae are slightly rotated, so you can't really get specific in A, line of drive, B, direction, and there's no real analysis on this. So number one, I always want to let you know that I understand the intent. These guys are, look, they're trying to help out the audience, trying to give you things to do at home to help you, try to empower you, and I certainly love that, and there's some really good things further in the video that I like. But when they're doing this maneuver, the first thing that comes to my mind is specificity, line of drive, what's going on, has it been evaluated, how do we know that that is the right thing to do at that time? You know, and what's the goal? Is it just to get a crack and hear a noise and get a release, or is it to correct a problem that if left uncorrected can cause a lot of damage to you in the future and also some pain in the present as well, right? So let's look further.
Down, I'll get different levels too. And I usually go about like to there, and then I'm done.
Some people do it as more like a hallelujah stretch, we call
Sure.
it. They
Yep.
bring their arms up, hallelujah,
Yeah.
and then back down again.
Yeah, I'm not doing that though.
So, as an alternative, if you don't have a chair that fits you, sometimes people can kind of put your hand in this position here, and you can actually take your hand.
Now you see in chiropractic there's certain maneuvers that we do where the chiropractor actually uses their hand. And so again, if you have any shoulder issues or back issues, you know, how do you do this potentially, right? And where is the specificity again? So consider when you're doing it yourself, you can't really properly assess it, especially if you're twisting your body. It changes the way the muscles are functioning, the joints are functioning. But if somebody's externally doing it, they can find out exactly what's going on. So when we use a hand contact, we can actually determine through the front where we're going to put that line of drive so we can get more specific. Again, feeling the spine at that moment, but also using technology like posture and x-rays and other testing to be able to see exactly the type and degree of problem that is. So again, the specificity, intention is there, but specificity really isn't. Now, using a foam roller is great. I certainly recommend foam rolling and stretching, and what he's showing you here is great, and I don't think he's doing this with the intention of necessarily cracking your back, but getting good flexibility into the joints. He's not doing any sort of forceful maneuver where he's leaning over and then trying to put a force in there, but he's literally going gently over there. So, you know, you want to do gentle maneuvers. You don't want to do the quick, what they call high velocity maneuvers, low amplitude, to get that, to induce that what's called paraphysiological space, which just is a fancy word for getting into the space where the joint may release there. Now, so stretching is great, and a lot of these are more stretches is what he's showing you, and certainly we recommend that in conjunction with seeing an expert that will help you, right? It's like you have, you brush your teeth, you floss your teeth, you do all the things to maintain your teeth, but you still have a dentist, right? You still have an oral care provider who's guiding you and assessing you for any other underlying issues. In these maneuvers here, they're talking about don't do this if there's a disc problem. Well, that begs to differ. How do you know if you have a disc problem, or how do you know if it's teetering on being a disc problem? Now, I've evaluated in my practice 17,000 people, have delivered over 200,000 adjustments, and that's going to give us a lot more clinical data than what you think you may have based upon watching a video on the internet. And so these are good stretches, and you want to be doing these stretches, but you see he's not doing a jerky motion, and so you're more than likely maybe might get a release, an audible, what they call a crack, but it's certainly not necessarily going to fix a misalignment pattern. It's just going to be adding some flexibility and stretching the back end, the lower back in this case here as well. So good intention. Again, these therapists are real popular on the internet, and I appreciate what they're doing, but I don't think this is showing you how to crack your own back. In fact, the guy even said it doesn't even produce him a crack as well. And again, we don't want a crack, we want a result, right?
Bring this shoulder forward, and now this one is there, this one's here, and again I can take deep breaths and oscillate, or just go ahead.
Definitely agree with him. When you're doing these stretching, you don't want to hold your breath. That's called a Valsalva maneuver. So you want to make sure that you are breathing. So this is essentially like yoga. So if you want to know how to do some things, this should be saying physical therapist showing you some really cool yoga maneuvers, not really how to crack your own back without a chiropractor.
I like to call it the Pretzel one. So the right knee is up, left elbow goes over the top, and then you look behind you like you're looking behind your rear window in your car, and then I press here.
I've done this maneuver quite often in yoga.
And then
His back is real straight when you're doing this. You're not bent.
And again, you have to think about if you're watching this video, why are you watching it? It sounds like by the title that you feel like you need to see a chiropractor. You're not sure maybe who to go to. So you're trying to do some home remedies at first. The problem is you probably have muscle spasm, there's inflammation in the joint. You can't move and have this flexibility. These guys are not obviously dealing with a health crisis, and you may be dealing with a health crisis. So you don't want to be doing something in a health crisis that is a maintenance maneuver. So sequence matters. So it's really important that if you are struggling with a back issue, which is probably why I attracted you to watch the video, you want to make sure that you see somebody who is going to carefully analyze what's going on, do a proper exam, who has training, been going to school for years for this, and is an expert that can objectively look at you versus react and say, well, I just need to do a quick crack in my back because I want to feel good in the moment. So I just really encourage you, if you're having an issue, yes, these videos are great in what's called supportive care, but they're not really good for primary care. And I would recommend, hey, these guys are great, check them out, go to their office, or if you have questions, you can give us a call, whatever you need to do. We just want to be able to encourage you to find the solution by getting it carefully analyzed first before you just try to crack your own back. So I'm Dr. Eric Janowitz. Please subscribe to our other videos or give us a call, whatever we can do to support you. Thank you.
Let's try that sign out again and say I'm Dr. Janowitz, subscribe to our channel or watch all our videos.
Okay.
Yeah.
Okay. So I'm Dr. Eric Janowitz. Subscribe to our channel or watch our other videos. Thank you.